April 21st, 1945, 14:30 hours, somewhere between Buchenwald concentration camp and the German border. First Lieutenant Helen Winters kneels on the filthy floor of a moving railway boxcar, her hands pressed against the swollen belly of a woman whose name she doesn't know. The woman is maybe 25 years old, maybe 40. Impossible to tell after years in the camps. She weighs 78 pounds. Her contractions started 20 minutes ago. The boxcar rocks and sways as the train rounds a curve at 30 miles per hour. 67 other liberated prisoners crowd the space meant for 40, their bodies pressed against wooden walls, their eyes hollow with trauma and hunger. The air smells like unwashed bodies, old straw, and fear. Helen has no medical equipment, no forceps, no scalpels, no anesthesia. Her aid bag contains 12 morphine syrettes, 6 bandage rolls, 2 bottles of iodine, and a pair of surgical scissors she's been carrying since Normandy. That's it, the woman screams. Her water breaks, soaking the straw beneath her. Helen presses 2 fingers against her neck, counting the pulse. 130 beats per minute, dangerously high. She lifts the woman's dress with shaking hands and sees what she was afraid she'd see. Breech presentation. The baby's feet are coming first, not the head. In a sterile hospital with trained staff and proper equipment, breech births are manageable. In a moving boxcar with no light and no instruments, they're often fatal. And this woman isn't carrying 1 baby, she's carrying 2. Helen closes her eyes for 3 seconds. Then she rolls up her sleeves, tells the woman to breathe, and prepares to do something she was never trained for. Deliver premature twins in a railway boxcar traveling 40 miles per hour through occupied Germany with nothing but her hands, her training, and 90 minutes before this train reaches the next station. 2 babies, 1 chance, 0 room for error. Helen Winters is 28 years old, from Portland, Maine. She enlisted in the Army Nurse Corps in January 1943 after her brother was killed at Guadalcanal, graduated from the medical training program at Fort Sam Houston in Texas, and deployed to England in May 1944. She landed at Normandy on D-Day +6, treated casualties at field hospitals in France and Belgium, and worked in a field surgical unit during the Battle of the Bulge, where she assisted with 73 amputations in 48 hours. She's seen more trauma in 18 months than most nurses see in a lifetime. But she's never delivered a baby. Army nurses treat soldiers, not pregnant women. Obstetrics wasn't part of her training. She knows the theory from nursing school, memorized the stages of labor, studied diagrams of fetal positions, but she's never actually done it. And she's definitely never delivered twins. Definitely never delivered breech. Definitely never delivered anything in a moving train. But 3 hours ago, when the U.S. Third Army liberated Buchenwald concentration camp and began loading survivors onto trains for transport to displaced persons facilities, this woman collapsed during boarding. A French-speaking prisoner explained, "Pregnant, 8 months, contractions starting." The train commander asked for a nurse. Helen volunteered. She climbed into the boxcar thinking she'd just keep the woman comfortable until they reached a proper hospital in 2 hours. Then the contractions accelerated. The water broke, and Helen realized she wasn't going to a hospital. She was delivering these babies here, now, in conditions worse than anything she's ever worked in. The boxcar has no windows except 2 small vents near the ceiling that let in narrow beams of afternoon sunlight. The floor is covered in dirty straw mixed with mud and God knows what else from the camp. The only light comes from those vents and the open door at the front of the car, which the guards keep partially cracked to provide airflow. Helen positions the woman as close to the door as possible to maximize light. 2 other women, survivors who speak broken English, volunteer to help. One holds the pregnant woman's hand, the other holds Helen's aid bag and follows her instructions. The train lurches forward. Helen braces herself against the wall as the woman screams again, her body convulsing with a contraction that lifts her off the straw. Helen checks her watch. 14:32 hours. The next station is 93 minutes away. She has 90 minutes to deliver 2 premature babies in breech position with no equipment and keep all 3 patients alive. The clock is running. The medical reality of what Helen is attempting is borderline impossible. Breech births occur in approximately 3% of all pregnancies, when the baby's feet or buttocks present first instead of the head. In modern hospitals with trained obstetricians, surgical teams, and emergency cesarean capabilities, breech births carry a fetal mortality rate of 2 to 3%. In uncontrolled settings without medical support, that rate jumps to 15 to 25%. Twin breech births are exponentially more dangerous. The first twin can block the birth canal, preventing the second twin from descending. Cord prolapse, where the umbilical cord drops through the cervix before the baby, occurs in 10% of breech cases and can cut off oxygen supply, causing brain damage or death within minutes. Premature twins at 32 weeks gestation, Helen's best guess based on the mother's size and the baby's estimated weight, face additional risks: underdeveloped lungs, fragile skin, inability to regulate body temperature. They should be in neonatal intensive care units with incubators, oxygen, and monitoring equipment. Instead, they're about to be born on a pile of straw in a freezing boxcar. Helen knows all of this because she paid attention in nursing school. She remembers her obstetrics instructor, a stern woman named Mrs. Patterson, explaining that breech deliveries require patience, skill, and the ability to rotate the baby manually if it becomes stuck. The instructor demonstrated on a mannequin, showing how to hook fingers under the baby's armpits and guide it out without damaging the spine or pulling too hard on the umbilical cord. But mannequins don't scream. They don't bleed. They don't die if you make a mistake. Helen's hands are shaking as she kneels between the woman's legs, trying to assess the situation by feel because she can barely see anything in the dim light. She can feel the baby's feet, tiny, perfect feet no bigger than her thumb, protruding from the birth canal. The feet aren't moving. This is bad. In a normal breech delivery, the baby's body should be rotating as it descends, allowing the shoulders and head to pass through the pelvis. If the baby is stuck, it means the body isn't rotating properly, which means the head could get trapped, which means the baby will suffocate before Helen can extract it. She needs to make a decision: wait and hope the baby rotates on its own, or intervene manually and risk damaging the baby's spine or neck by pulling too hard. The woman screams again, a sound that cuts through the noise of the train like a knife. Another contraction. Helen feels the baby's body shift slightly, rotating counterclockwise. Good. That's good. The baby is trying to turn. Helen makes her decision. She'll assist the rotation manually, guiding the baby's body with gentle pressure while the contractions provide the force needed to push it out. It's risky, but waiting is riskier. She looks at the 2 volunteer assistants and says 4 words: "Hold her shoulders down." Then she slides her hands into the birth canal and begins the most terrifying procedure of her medical career. At 14:41 hours, 9 minutes after the contractions started, Helen feels the first baby's torso begin to emerge. The process is agonizingly slow. With each contraction, the baby advances maybe half an inch, about the width of a pencil, before sliding back slightly when the contraction ends. Helen uses her fingers to support the baby's body, preventing it from dropping too quickly and damaging the umbilical cord. The baby's skin is slippery with amniotic fluid and blood. Helen's hands keep slipping, losing grip. She wipes them on her uniform, leaving dark red stains on the olive drab fabric, then repositions and tries again. The woman is exhausted. Her screams have faded to whimpers. Her pulse is racing at 140 beats per minute. Helen can see her ribs through her skin, can count every vertebra in her spine. This woman has been starved for months, maybe years. Her body has no reserves left. She's running on willpower alone. Another contraction. The baby's shoulders emerge. Helen hooks 2 fingers under the tiny armpits, exactly like Mrs. Patterson demonstrated in nursing school, and applies gentle traction downward and slightly toward the mother's tailbone. This is the critical moment. The head is still inside, and if it doesn't follow the shoulders smoothly, the baby will die. Helen pulls. Too hard and she'll break the baby's neck. Too soft and the head will get stuck. The train hits a rough section of track. The boxcar bounces violently, throwing Helen off balance. She nearly loses her grip on the baby. One of the assistants grabs her shoulder to steady her. Helen adjusts her position, plants her knees firmly in the straw, and pulls again with controlled force. About the same pressure she'd used to open a stuck jar, not hard enough to break anything, but firm enough to make progress. The baby's head emerges. All at once, a rush of fluid, a tiny face covered in mucus and blood, and suddenly, Helen is holding a complete human being in her hands. A boy, maybe 3 pounds, about the weight of a small bag of sugar, skin pale and translucent, veins visible beneath like blue threads, eyes closed, not breathing. Helen's heart stops. The baby isn't breathing. She tilts him head down to drain fluid from the airways, then uses her finger to clear mucus from his mouth and nose. Still not breathing. She flips the baby onto his stomach on her forearm, supports the head with one hand, and uses 2 fingers to deliver firm back blows between the shoulder blades, the infant CPR technique she learned but has never used. 1 blow, 2, 3. The baby gasps, a weak, wet sound, then another gasp, then a thin, reedy cry that sounds more like a kitten than a human infant. He's breathing, alive. Helen wraps him in a blanket one of the assistants provides, actually a torn piece of someone's coat, and hands him to the second assistant with instructions. Keep him warm. Don't let him get cold. Then she checks her watch. 14:48 hours, 7 minutes to deliver the first twin. 1 down, 1 to go, and the second twin is already descending. The second twin presents even worse than the first. Complete footling breech with 1 leg extended and 1 leg folded. This is the nightmare scenario. With 1 leg folded, the baby's body can't rotate properly through the birth canal. The hip joints are at the wrong angle. If Helen pulls too hard, she'll dislocate the hip. If she doesn't pull hard enough, the head will get stuck and the baby will suffocate. She needs to manually reposition the folded leg before the baby descends further. This requires reaching into the birth canal, already stretched to its limit by the first delivery, and manipulating the baby's leg into the correct position without causing damage. Helen has never done this, never seen it done. She's operating purely on theoretical knowledge from a textbook she read 3 years ago. But the alternative is letting the baby die, which isn't an option. She tells the mother to breathe through the next contraction without pushing. Impossible advice for someone in active labor, but necessary to buy time. Then Helen slides her right hand back into the birth canal, feeling for the baby's folded leg. Her fingers find it. A tiny knee bent at 90 degrees, tucked against the baby's chest. She needs to extend this leg downward so both feet are presenting together. This requires flexing the knee joint in the opposite direction, while the mother's pelvic bones are compressing everything with tremendous force. Helen takes a breath, hooks 2 fingers behind the baby's knee, and pulls gently downward. The leg extends. She feels the foot drop into position next to the other foot. Success. Both feet are now presenting together. The baby can rotate properly, but the mother is hemorrhaging. Helen sees blood pooling beneath her, more blood than should be coming with the placenta still attached. Postpartum hemorrhage. Either a torn cervix or a separated placenta causing internal bleeding. If Helen delivers the second baby now, the mother might bleed out before they reach the hospital. But if she delays delivery to control the bleeding, the second baby will die from oxygen deprivation. She has to choose: save the baby or save the mother. She can't do both. Helen makes the choice in 3 seconds. She'll deliver the baby fast, then deal with the hemorrhage. The baby has maybe 10 minutes of oxygen left. The mother has maybe 30 minutes before blood loss becomes critical. Deliver first. Stop bleeding second. Move. At 1500 hours, 18 minutes after the first twin was born, Helen delivers the second. This one comes faster. The birth canal is already dilated. The mother's body knows what to do. Helen guides the baby out with both hands, supporting the torso and rotating gently to help the shoulders pass through the pelvis. The head emerges. Another boy, smaller than the first, maybe 2.5 pounds, about the weight of a large pineapple. Skin blue-tinged, not breathing. Helen doesn't have time for careful CPR. She holds the baby upside down by the ankles and delivers a sharp smack to the bottom of the feet. It's an old technique, no longer taught in modern medicine, but effective. The baby gasps, chokes, and starts crying. A stronger cry than his brother. Good lungs. Helen wraps him in another torn coat, hands him to the assistant, and immediately turns her attention back to the mother, who is now losing blood at an alarming rate, about the same volume as an overturned coffee cup every 30 seconds. The placenta hasn't delivered yet. It should have come out with the second twin, but it's still attached inside the uterus. This is causing the hemorrhage. The uterus can't contract properly to close the blood vessels while the placenta is still connected. Helen has to remove it manually. This is called manual placental extraction, and it's one of the most dangerous obstetric procedures. Done incorrectly, it can perforate the uterus, cause massive bleeding, or introduce infection that leads to sepsis. But doing nothing means the mother bleeds to death in the next 20 minutes. Helen slides her hand back into the birth canal one more time, feeling for the placenta. She finds it, still attached to the uterine wall. Using her fingers like a spatula, she carefully separates it from the wall, peeling it away bit by bit. Blood pours out. More blood than Helen has ever seen from a single patient. The straw beneath the mother is soaked dark red. The smell is overwhelming, metallic and warm. The placenta comes free. Helen removes it completely, checking to make sure no fragments are left inside that could cause continued bleeding. Then she presses both hands against the mother's abdomen and massages the uterus, forcing it to contract. This is excruciatingly painful for the mother. She screams, thrashes, tries to pull away. The two assistants hold her down while Helen keeps massaging, applying firm pressure that feels brutal but is necessary to stop the bleeding. After 2 minutes of continuous massage, Helen feels the uterus firm up beneath her hands, a hard ball of muscle about the size of a grapefruit. The bleeding slows, then stops. The mother is alive, weak, pale, barely conscious, but alive. Helen collapses back against the boxcar wall, her arms shaking from adrenaline and exhaustion. Her uniform is soaked with blood. Her hands are cramping. She checks her watch. 17 hours, 47 minutes total from first contraction to placenta delivery. Both twins alive, mother alive, mission accomplished. Then she looks at the babies, 2 tiny boys wrapped in torn coats, held by women who don't know how to care for premature infants, and realizes her job isn't done. These babies need warmth, oxygen, monitoring. They're premature, underweight, born in filthy conditions. Without proper medical care, they'll be dead within hours. The train is still 50 minutes from the next station. 50 minutes to keep these babies alive with no equipment, no incubator, no oxygen. Helen pushes herself to her feet. The hard part isn't over. It's just beginning. Premature infants lose body heat 20 times faster than full-term babies, about the same rate as a small animal loses heat in winter. The boxcar is cold, maybe 50 degrees Fahrenheit, about the temperature of a refrigerator. The babies, born wet and weighing less than 3 pounds each, are losing heat so fast their core body temperatures are dropping by half a degree every 5 minutes. Hypothermia in newborns causes respiratory failure, brain damage, and death. Helen needs to warm these babies immediately. She instructs the 2 assistants to hold the babies against their chests, skin to skin, beneath their clothing. This technique, called kangaroo care, uses body heat to keep newborns warm when incubators aren't available. It works, but only if the person holding the baby maintains their own body temperature. These women are concentration camp survivors. They're malnourished, hypothermic themselves, running on empty. Their body temperatures are probably only 96 or 97 degrees, barely enough to keep themselves alive, let alone warm a baby. Helen takes off her field jacket and wraps it around both assistants and the babies, creating an insulated bundle. Then she positions them against the boxcar wall, where sunlight from the vent is streaming in, adding a few degrees of radiant warmth. It's not enough, but it's something. Next problem, breathing. Premature lungs lack surfactant, a substance that keeps the tiny air sacs from collapsing. Without surfactant, every breath requires enormous effort. The baby's respiratory rates are too fast, 60 breaths per minute when they should be 40, and the breaths are shallow. Helen can't fix this. There's no medication she can give, no treatment except time and oxygen. She watches the babies breathe, counts each rise and fall of their tiny chests, and prays they don't develop respiratory distress severe enough to stop their hearts. The mother is unconscious now, either from blood loss or exhaustion. Helen checks her pulse, 90 beats per minute, weak but steady. Blood pressure is impossible to measure without equipment, but the woman's skin is cool and pale, suggesting shock. Helen elevates the woman's feet using folded coats to improve blood flow to the brain. She covers her with blankets to prevent further heat loss. She checks for continued vaginal bleeding, minimal, which is good. Then she sits down next to the mother and the babies, pulls out her morphine syringes, and realizes she can't use them. Morphine would help with the mother's pain, but it suppresses breathing, which the premature babies can't afford. If any morphine transfers through breast milk to the infants, it could kill them. So Helen does the only thing she can do. She monitors vital signs, adjusts positions to maximize warmth, and waits. The train rolls through the German countryside at 40 miles per hour. Through the open door, Helen can see forests, fields, occasional villages. The war is still happening. Smoke rises from distant towns. Artillery rumbles faintly to the north. But inside this boxcar, the war has paused. 3 people are clinging to life. 2 have been alive for less than an hour. 1 has been alive through hell and somehow survived. Helen watches them breathe, counts breaths, counts heartbeats, counts minutes. 43 minutes to the next station. At 15:40 hours, the first twin stops breathing. Helen sees it happen. The baby's chest rises, falls, then stops. No movement. The tiny face begins to turn blue. She grabs the baby from the assistant, places him on her lap, and begins infant CPR. 2 fingers on the chest, just below the nipple line, compressing 1/3 the depth of the chest. 30 compressions at the rate of 100 per minute, almost 2 per second. The baby's chest is so small, her fingers nearly touch his spine. She's terrified of breaking ribs, but she has to compress deep enough to circulate blood. After 30 compressions, she tilts the baby's head back, gently, because the neck muscles can't support the weight, and delivers 2 rescue breaths by covering the baby's nose and mouth with her mouth and exhaling softly. Just a puff of air, about the same volume as blowing out a birthday candle. Nothing. The baby doesn't respond. Another 30 compressions, 2 breaths, nothing. Helen's training says to continue CPR for 20 minutes before declaring death, but she knows the statistics. Infant CPR success rate is less than 10%. Premature infant CPR in field conditions is effectively 0. She keeps going anyway. 30 compressions, 2 breaths. Check for pulse. Nothing. 30 more compressions. The other passengers in the boxcar are watching in complete silence. 67 people, many of them parents who lost children in the camps, watching this American nurse try to resurrect a baby born in the same kind of boxcar that transported them to death. 1 minute of CPR, 2 minutes, 3. At the 4-minute mark, the baby gasps. 1 shallow breath, then another, then a weak cry. He's back. Helen doesn't know how or why, doesn't know if it was the CPR or if the baby would have started breathing on his own. Doesn't care. She wraps him back up, hands him to the assistant with firm instructions. Watch him constantly. If he stops breathing again, call me immediately. Her hands are shaking so badly she can barely hold the stethoscope she doesn't have. She checks her watch. 15:45 hours, 33 minutes to the next station. The second twin is still breathing. The mother is still unconscious but stable. 1 crisis averted. Helen sits back against the wall, closes her eyes for 5 seconds, and lets herself feel the exhaustion she's been suppressing for the past hour. Then she opens her eyes and goes back to monitoring vital signs, because 33 minutes is a long time and anything can happen. The train slows as it approaches the station at 16:18 hours, 93 minutes after the first contraction started. Helen has spent the last half hour in a state of hypervigilance, checking both babies every 60 seconds for breathing, color, and movement. The first twin has had 2 more breathing pauses, both resolved with stimulation, rubbing the feet, flicking the soles, without requiring full CPR. The second twin has been more stable, breathing steadily despite his prematurity. His color is better, his cry stronger. He's the fighter. The mother regained consciousness at 1600 hours, confused and weak but alive. She asked to see her babies. Helen brought them to her, one at a time, and helped her understand through gestures and broken German that she has 2 sons, both alive, both safe. The woman cried. Not loud sobs, but quiet tears that ran down her hollow cheeks and dripped onto the straw. She touched each baby's face with trembling fingers, whispered something in a language Helen doesn't recognize, Polish maybe, or Czech, then closed her eyes and drifted back into exhausted sleep. Now the train is pulling into the station, a small depot somewhere in western Germany that's been commandeered by American forces. Medics are waiting on the platform, alerted by radio that there are medical emergencies on board. As the boxcar slows to a stop, Helen gathers the babies in her arms, both of them now, 1 in each arm, and prepares to transfer them to proper medical care. A stretcher team boards immediately. Helen gives a rapid report. 2 premature twin males, approximately 32 weeks gestation, delivered Breech in transit 90 minutes ago, both experiencing respiratory instability. First twin had multiple apnea episodes, required CPR once. Second twin more stable. Mother had postpartum hemorrhage, controlled with manual placental extraction and uterine massage. All 3 patients need immediate hospital transfer. The head medic, a captain, stares at Helen for 3 seconds. Then he says, "You delivered twins? In a moving boxcar? Breech?" Helen nods. "Jesus Christ," the captain says. "That's either the bravest or the stupidest thing I've ever heard." "Probably both," Helen says, and hands him the babies. The transfer takes 15 minutes. Mother and both twins are loaded onto ambulances and transported to a field hospital 12 miles away. Helen climbs down from the boxcar, her legs nearly buckling from exhaustion and adrenaline crash. Her uniform is destroyed, covered in blood, amniotic fluid, and God knows what else from the boxcar floor. Her hands are cramping so badly she can't make a fist. Her back aches from kneeling on the floor for 90 minutes. But she's done. The babies are alive. The mother is alive. Mission accomplished. A Red Cross worker approaches with coffee and a blanket. Helen accepts both, sits down on a bench on the platform, and lets herself shake for the first time in 90 minutes. She doesn't cry, doesn't celebrate. She just sits there, drinking bad coffee and watching the ambulances drive away, carrying 3 people who shouldn't be alive but are. Because sometimes, in the middle of war and death and horror, life happens anyway, even in a boxcar, even without equipment, even when every textbook says it's impossible. Sometimes life just happens, and all you can do is catch it when it arrives. The field hospital confirms what Helen already knows. The delivery was successful against impossible odds. The twins are admitted to the neonatal ward, a converted warehouse with makeshift incubators fashioned from wooden boxes and heated water bottles. Both babies are stable but fragile. First twin weighs 2 pounds 14 ounces. Second twin weighs 2 pounds 9 ounces. Both are placed on oxygen support and monitored around the clock. The mother recovers slowly. She's diagnosed with severe malnutrition, anemia from blood loss, and infections from the camp conditions. But she's alive. More than that, she's lucid, aware, present. A translator speaks with her 3 days after delivery. Her name is Sarah Lieberman. She's 26 years old, from Krakow, Poland. She was arrested by the Gestapo in 1942, sent to Auschwitz, then transferred to Buchenwald in early 1945 when the camps began evacuating ahead of Allied advances. She got pregnant in the camp. The father was another prisoner, a man named Joseph, whom she married in a secret ceremony conducted by a rabbi who was later executed. Joseph died of typhus 2 months before liberation. Sarah never told the guards she was pregnant because pregnant women were usually killed. She survived 9 months of pregnancy in a concentration camp by hiding her condition, giving her food rations to other prisoners to maintain their strength, and praying that liberation would come before she went into labor. It almost didn't. The contractions started the same day American forces arrived at Buchenwald. If liberation had come 1 day later, Sarah would have given birth in the camp. The babies would have been killed. She would have been killed. Instead, she gave birth in a boxcar with an American nurse who had no idea what she was doing, but did it anyway. The translator asks Sarah if she has any message for Lieutenant Winters. Sarah thinks for a long time. Then she says, "Tell her she gave my son's life in a place of death. Tell her I named them Joseph and David after their father and my brother who the Nazis killed. Tell her that every day they live is because of her hands. Tell her I will never forget." The translator delivers this message to Helen 2 days later. Helen, who has been trying very hard not to think about the delivery because thinking about it makes her realize how many things could have gone wrong, listens in silence. Then she says, "I was just doing my job." But it wasn't just a job, and she knows it. Helen Winters returns to the United States in December 1945 after 18 months overseas. She's discharged from the Army Nurse Corps in January 1946 with the rank of captain. She returns to Portland, Maine, works at Maine Medical Center for 3 years, then moves to California, where she becomes head of obstetrics at a community hospital in Oakland. The irony isn't lost on her. She delivered her first babies in a boxcar with no equipment. Now she's supervising a modern labor and delivery ward with incubators, monitors, and surgical suites. She trains hundreds of nurses over her 30-year career. Many of them never know about the boxcar delivery. Helen doesn't talk about the war much. When students ask about her military service, she gives short answers. Field hospitals in Europe, routine trauma care, nothing special. But occasionally, when a delivery goes wrong, breech presentation, postpartum hemorrhage, premature twins, Helen tells the story. She tells it clinically, without drama, just the facts. Breech twins, moving boxcar, no equipment, improvised with shoelaces and torn coats. Both babies survived. The students listen in amazed silence. Then they ask, "How did you stay calm? How did you know what to do?" Helen's answer, "I didn't stay calm. I was terrified. But being scared doesn't mean you stop working. You just work scared." That becomes her teaching philosophy. Work scared. Make decisions with incomplete information. Improvise when protocols don't fit the situation. Never give up on a patient just because the textbook says it's impossible. Some of her students adopt this philosophy, others don't. But the ones who do, the ones who learn to work scared and improvise and refuse to accept failure, become the best nurses Helen ever trains. Helen Winters dies in 2004 at age 97. Her obituary mentions her military service, her Bronze Star, and her career as a nurse and obstetrics administrator. Joseph and David Lieberman attend the funeral in Berkeley. They're 69 years old now, both are grandfathers. Between them, they have 7 children and 14 grandchildren. All of those descendants, 21 people total, exist because Helen Winters volunteered to board a boxcar in April 1945. In the end, the story of Helen Winters and the boxcar delivery is about one woman's refusal to accept the unacceptable. The textbook said breech twins born premature in unsanitary conditions without medical equipment would die. Helen refused to accept that. She improvised, used torn coats and body heat and determination, made decisions in seconds that should have required consultation with specialists, performed procedures she'd never done before using techniques from textbooks she'd read years ago. And somehow, through skill, determination, and luck, she succeeded. 2 boys lived. Their mother lived. 21 descendants exist who wouldn't exist otherwise, all because one nurse boarded a boxcar when she didn't have to and refused to quit when quitting would have been easier. One woman, 90 minutes, 3 lives saved. That's